This is a skin lesion seen very often in podiatry called the pinch callus. We call it the pinch callus because the skin gets trapped between the underlying bone and the shoe on top, literally pinching the skin with each step. The center of this callus is so hard and so thick that I needed a toenail nipper to cut it out before shaving it down with the scalpel. Look how thick that is. You can imagine how painful that is after being on your feet for hours every day working as a custodian like this gentleman. Now that the thick, hard center has been removed, I can shave down the callus with the scalpel. Here is where the problem takes place. This bone in the big toe is called the distal phalanx, and this part sticking out is called a condyle. The condyle and its overlying skin and soft tissue become the focal point of pressure and friction, causing the pinch callus. The protruding condyle is not the only culprit here. There are usually several accomplices, like shoes that are too small and tight, arthritic conditions of the big toe joint, which cause stiffness and decreased range of motion, which therefore puts more pressure on the side of the toe. A bunion can cause rotation of the toe, putting the condyle in contact with the walking surface. Chronic dry skin increases friction. Not wearing socks or stockings also increases the friction between the shoe and the skin. Neuropathy that we often see in diabetes and other conditions that cause nerve loss cause the patient to not feel any pain, so they don't understand that something's going wrong, so the callus continues to persist. As a matter of fact, this is a very common area for diabetics to develop foot ulcers. I have heard people say that calluses should be left alone because they are the body's defense mechanism to prevent skin breakdown because of increased pressure and friction. To some degree that's true, but if calluses get out of control and get extremely thick and extremely hard, like in this case, they can cause rupture of the underlying capillaries or microscopic blood vessels in the skin, and eventually ulceration and extreme pain. Now that debridement of the callus has taken place or shaved away, I can concentrate on enucleation of the core or the porokeratosis overlying the condyle. I like to use a dental scaler or pick to loosen the porokeratosis. It's sharp, but it's not as sharp as a needle, so I can perform this maneuver without risking injury to the patient. It is completely pain-free. Using the wider end of the dental scaler, I can easily lift the porokeratosis away from the underlying bone, gently without causing any discomfort or any injury to the patient. Now that the porokeratosis has been lifted, I can remove it with the scalpel very easily. There is no pain, there is no bleeding, and it looks very good, and the high pressure area over the condyle has been completely removed. Now the trick after all this work is to prevent the pinch callus from coming back, and that's done in several ways. The patient may have to return every 2 or 3 months a few times in order to keep the callus reduced. I recommend padding such as moleskin, toe sleeves, and callus pad to help reduce the pressure and friction that cause this lesion. I am not a big fan of callus removers. They can cause chemical burns, especially in very vulnerable patients. Wider shoes and insoles are also very helpful. If all else fails, surgical removal of the condyle is necessary. This is Kevin Jefferson, the DC Foot Doctor. Thank you very much for watching this video. Like it with a big thumbs up and subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Share it with your family and friends. If you leave a comment or a question, it may be featured in a future video. But most importantly, take care of your feet.